Hello everyone, I just wanted to share with you a particular experience I've had and hopefully maybe help some of you out. With CF, weight is a big issue, it's very, very important. There's a huge correlation between weight and lung function. If you can maintain a healthy weight, lung function and overall health tends to be better. People with CF have to eat 150% more calories than people without CF, which is really hard when you don't have an appetite, and people with CF also can get a lot of tummy problems. This happened to me. I was feeling really sick, really bloated, vomiting, really not being able to eat, feeling really, really full all the time. And I've always had probiotics. Mum started me on Yakult as a kid, and then I went on to the Activia, and then Culturelle, so we've tried a few different ones, and none of them kind of helped hugely. The hospital just gave me anti-sickness medication, because that was all they could kind of offer, and these really didn't help. They didn't really help with the sickness. I still felt sick, I was still vomiting, but they gave me headaches and I felt dizzy and awful and they were horrible. So they work for some people, they just weren't right for me. And so after 3 years, I got an appointment for a joint clinic with my CF team and a gastroenterologist. And so myself and Mum went to this appointment and we were discussing all my symptoms, and Mum happened to mention about the probiotics, and he then told us about a probiotic that he's used with other patients and has found to be very, very good for other patients, and it's this one, Symprove. So it's been absolutely fantastic for me. It's a 12-week program, so this is 1 week's worth of medication. It's just basically replaces the natural good bacteria that everyone should have in their guts. The friendly bacteria that help us digest our food and everything. With all the antibiotics that I have because of my CF, the antibiotics can kill the good bacteria as well as the bad. So obviously I don't have a very good friendly bacteria colony in my tummy. But this has really, really helped me. Within a few days of taking it, I noticed a huge difference. Less bloated, less sick, less vomiting, just all my symptoms reduced. Unfortunately, I couldn't take it to the Dominican Republic, and I really noticed the difference. Within a few days, I was back to my old kind of sicky self. So I got straight back on it when I came home, and again, the changes very, very quickly. I was able to eat again, and mealtime stopped being this dreaded black mark on my day that I didn't enjoy meals at all, whereas now I do, and I can eat, and I can eat in a normal amount of time, whereas before it would take me hours and hours and hours of forcing down the food. It's not nice eating when your body's trying to throw up, but obviously I have to eat because I need to gain weight, so, and my weight as well, I need to be 58 kilos, ideally, that's my ideal weight for my lungs, and I've not been able to get beyond 54 kilos for quite a few years. I've just kind of yo-yoed, up and down between 50 and 54. But then with the Symprove, before I got the tummy bug, I actually got to 56.5 kilos, which was incredible. Myself and Mum were delighted. And then with the tummy bug, I lost some weight, but I'm hoping to gain that back now that I've got over the tummy bug. But yeah, I just wanted to recommend this for anyone, especially with CF, even if you don't have CF, with any tummy problems. It's really, really, really helped me. So I'm just hoping maybe it could help you too. So thank you very much for watching, and thank you so much for all your support with everything throughout all this. It's been so lovely having all your messages. It's really, really helped kind of keep me positive and keep me smiling. I've sent off the complaint to Kings now, so that's a huge weight off my mind. And again, thank you so much for all your support through that. It was so lovely to know that so many people cared and were on my side. So yeah, just thank you so much for everything you've all done.